So the question was, will the co-op eliminate the need for private insurance? The question was, will the co-op eliminate the need for private insurance, or would it be one option amongst other options? Now, those of you who happen to live in rural areas, I know we have a few people here, know that usually in a cooperative everybody contributes and it provides back a certain amount of services. As we discuss the details across the way, what I would envision is that the cooperative would provide the basic level of services for everyone in the state. And as a primary care physician, my vision of what is basic includes mental health and dental health. But there are things that it would not necessarily finance, and people could choose if they wanted to, just as people do with Medicare, to purchase a supplemental plan to cover things that are not necessarily covered by a cooperative.
So you see this working in tandem with the exchanges that are envisioned? Is this part of your choices in the exchange?
So my idea is that in 2014, as many of you know, assuming that national health reform has not been turned over, we will be given the responsibility to purchase some type of insurance for ourselves, any people who don't have insurance. Now, the predictions by the Colorado Health Institute are that in spite of that law, in 2019, 258,000 people in Colorado will still be without health insurance. What we would put to the voters in a ballot measure, ideally referred by the legislature, but if not, perhaps by some citizens, would be the option to vote in that we would have a cooperative to satisfy our mandate requirement, or that we would go ahead and move forward with the exchange. And what it would be is that if you see that the plan that's made by the cooperative would work out to your advantage in terms of your values and your costs, you would vote yes for the cooperative, and then it would become operational in lieu of products in the exchange for the state of Colorado. In national health care reform, there are some grants for innovation around healthcare delivery and financing, because there is some concern that the cost on a fee-for-service model would be unsustainable in healthcare. What fee-for-service means is doctors are only paid if they do something for you or physically see you, and they're not really paid if they keep you healthy. In fact, it's to the detriment of their pocketbook to have you not needing to come and see them. And so what we would like to do is design a system where the money is in the system and your payment is not based on how much you do, but on how healthy you keep your population.
Voters choose to implement the co-op. Does that mean that the exchanges do not exist? The co-op or the exchange, it's not both.
So if voters chose to implement the exchange, most likely if voters chose the cooperative, most likely the exchange would not be needed for basic health insurance. It could be available still for supplemental policies, and it could be available for people who are out of state who want to move here, who do not qualify yet for the cooperative.
Do you have any Republicans who work here?
Right now, I have not actually. I've been working on my Democratic senators, to tell you the truth, and Representative Fellis has been working in the House. I actually have started speaking with some Republicans who I've been really pleased with how they vote and what they talk about. I have a number of Republican colleagues who represent, in particular, rural areas. And those of you who know about some of the issues in rural areas, there are a lot of people who don't have access to health care and can't afford the plans that are available for them in the rural areas. And these senators, in this case, because that's who I mostly get to hear, are really concerned about the health of their population and being sure that anything that happens benefits their population as well. And so I am going to be speaking with them. And the other day, actually, I surprised Senator Ted Harvey by voting for a bill that he sponsored. So I told him he needs to be surprised by me more often, that I really am about cost, savings, and efficiency, and that it's possible to be cost-conscious, efficient, and do the right thing. So I'll be talking to him at least. You don't have to say.
In 19... Tell them.
My husband has had a stroke and has to...
But I have a good... In 1967, a white woman was shot by Dear God. No, it's no, it's real. It's real. He wants me.
He was murdered at Kimbrough Ranch, and he died immediately on the front lawn.
We want to know. God.
It has affected both of us physically as well as mentally.
Oh.
So it's very important for us to be good.
But the respect was they got. Go ahead. No, it was.
Thank you so much for coming, and I'm sorry for your loss.
No,
Anyone who
it's
has,
real.
Yes, okay, Carl.
anyone who has more questions or would like more information, please feel free to join us in Legislative Services Building A. Thank you so much for coming.
Extra preparation for everyone who's